So how to prepare for NEET MDS? What are your views and how best we can achieve good marks? So little elaboration I want from your side.
Sir, first of all, there are around 19 to 20 subjects which we have to prepare for NEET MDS.
Right.
Sir, it consists of basic subjects, medical subjects, and clinical dentistry subjects. Sir, I think one must be, first of all, having confidence in oneself that I will be, because we have completed the course of 5 years and we have done cases, we have treated patients, we have encountered uh, what is being asked, we are already being taught in the 5 year course. So, first of all, being confident in oneself and then starting the preparation, sir, it is not about just about reading, it is about solving MCQs. It is um, a person who solves many MCQs can remember facts and theory very well because theory we all know what is important is what is asked in the question and to deliver the answer correctly. So that comes by solving a lot of MCQs. So that should be the part. And sir, apart from MCQ solving, sir, revising is one aspect that because uh, it is a human tendency to forget things. And these are things which are very factual and not very interesting to remember. So we have to train our mind to again and again memorize those things. So whatever we have studied, we have to revise them like at some gap. We can revise it next day, whatever we have studied today, and after 10 days, maybe after 1 month. So we have to keep that thing circulating in our mind, and we have to keep train our mind that we already know the things and just practice questions and then it will be fine. First of all, we have AIMS on 9th November, INICT exam on 9th November, and then maybe in March, uh, NEET MDS, sir.
So in this limited time, what should be the best strategy?
So the best strategy is take a test series, follow the test series, and have confidence. That I always say, sir, there is nothing. If we are not confident, we will not be able to. If we self doubt, we will not be able to compete with maybe 30,000, 50,000 students are appearing for this examination. So we have to trust ourselves that we can do it and join a test series and practice questions, go through previous year questions, sir, because previous year questions are not just questions, but they also tell us about the important topics that are repeated frequently. So previous year question solving is the key, and revision, sir, that is the mainstay for this preparation, sir. Sir, your voice, yes, sir.
As compared to previous papers, now is there any change in their patterns of questions? Because in NEET PG, the pattern has changed totally in these years.
Yes, sir. Sir, the first change is that we have a time limit and the exam is given. So NEET MDS is given in two sections. So one is the basic section and one is the clinical section. So it is not like that we have marked one question and we can revisit that question after some time. Once the section is closed, we cannot revisit. So um, we have to really focus on what we are reading and understand the question and mark the right answer in one go. Sir, we also have to manage our time because it is in two sections. We cannot go back to first section once it is closed. So
Okay.
this has been a change. And sir, also clinical questions are more
More, right.
asked these days. Yes, sir.
Right, right. Even in NEET PG also this occurred
Yes, sir.
and same case. Okay. Wonderful, doctor. You have really given good views on NEET MDS also. I'm proud of you. Whenever
Yes, sir.
Army Dental doctor talks to us, they say, sir, how can it be possible for us to develop ourselves in 7 days from PD classes? So now what are your views?
Okay, sir. Sir, so talking about PD classes, sir, uh, we all have studied this course of I mean we have completed the BDS course, so there is nothing like And if we are getting shortlisted for the interview, then everyone must have some knowledge about the subject. But PD classes have taught me about other aspects of this interview, which are very crucial, which we do not get to know during our college years, such as body language, speaking skills, clear communication, and even knowing about our achievements and feeling proud in telling them. And sir, PD classes have, this one-to-one classes you really boost the um, motivation. And since it is one-to-one, so we don't feel any hesitation. And sir, it is very motivating and knowledgeable lectures. You tell us more about being confident and body language skills, how to talk, how to communicate, and how to answer questions very effectively, so that we can, whatever knowledge we have, we can deliver it very nicely in a well articulated manner. So PD classes have been very helpful in that. Um,
Thank you for your
yes,
kind
sir.
testimonial. We are really proud of you. Now that doctor, again an important question. What is the work profile of a dentist? Tell in detail.
Sir, the work profile of a dentist, as the patient enters, first of all, is relieving the anxiety of the patient and um, treating the diseases associated with the teeth, such as caries, the periodontal ligament uh, cases, and surrounding structures. Sir, nowadays, oral cancers are also being increasingly prevalent among Indian society. So, see, the work profile of a dentist is very broad, sir. Actually, apart from teeth, we deal with many other structures, and such as the supporting structures, alveolar bone, the mucosa, the epithelium, and sir, it is very versatile. The work profile of a dentist is very versatile with this aspect, sir.